Dr. Lagoy, thank you so much for being on our podcast today.
Hi, Mary Grace. It's an honor to be here. You do a great job, and I've listened to your show for years, so it's just an honor to be considered to be on the show. Thank you.
Of course. And we're actually kind of approaching in this month of November, we're talking about kind of more serious topics. And today's topic is about kind of assisting family members and friends and those around us that suffer with some severe depression and potentially like suicidal thoughts and stuff. So I was wondering if you could give us a little bit of background about how you got into your psychiatry and your practice right now.
So I'll try to make this quick. I graduated med school in 2015, and at the time I wanted to be a surgeon. And I guess long story short, so in undergrad, I was a philosophy major. And I don't know if you know Father Jeff Langan. He's been on the show. He's the reason I became a philosophy major at college. And that there was something I just felt there's more to the human person than just the body, right? Like you can go into surgery and fix a bone, but if someone is depressed or has anxiety or has mental illness, it's like it's a deeper problem. It's a mental problem, sure, but it's also involves the soul, I think. So, and I'll talk for myself because mental illness is a very delicate topic.
Mhm.
I've had mental illness myself. I've suffered from depression. I can go through my history. Like I've been like rejected many times to med school, and then I felt depressed and lonely after college. So it's something I've gone through personally. My family's had mental illness. So it's something that's close to me, right? It's something real. And then when you go to med school, everybody goes to med school, whether you become a surgeon or a pediatrician, whatever. But at the end of med school, you decide your specialty. So in my third year, I wanted to do surgery, but then when I did my psych rotation, it was like a vocation. You know, when you get called for a vocation or something, it's hard to describe a vocation, but it's just a feeling you have, like, oh, this is what I was meant to do, or it's my purpose, you know. And I guess I had a moment like that in med school during my third year in the psych ward. And that's why I became a psychiatrist. That's the quick answer. I could talk more, but yeah, and then I guess I'll say a few more things. The philosophy. I went to a school called the Heights. Shout out to the Heights. And we had there was a week every year called Crescete Week. And so we go out and do service trips or go here, go around the world. And I went on a service trip to Mexico my sophomore year. And long story short, I had to go to the hospital. I cut my leg and I was in the hospital. And I remember it was really dirty and there was, it was no offense. I love Mexico, but it was a poor hospital. But I had another moment there where I felt this is, I think I should be a doctor. I think there's something about even though it's not very nice or it's dirty or it's poor, like I felt the calling to do it, like to serve. And then last thing I'll say is I did missionary work. So I got rejected from med school twice, which was kind of interesting because it was the best failure of my life. Because if I had gotten in, I would not have done missionary work. So after college, I went to the Philippines with a group called Consolatios. So shout out to them. Long story short, basically, it's a missionary work where we worked with the poorest of the poor. So we went to the prisons, the orphanages, and that was our service, right, for the church. But it was interesting because we didn't do anything for them. Like we didn't make houses, we didn't build anything. We just were present. We were just friends of people who had no friends, the lonely. So if someone was on death row, we would, befriend them in the prison. Or if someone's an orphan, or I mean, I could talk more about this, but it's really the friendship. That was the mission, the Catholic mission I went on. So that also tied into why I chose psychiatry because I guess like health is a big part of health, even more than the physical is the mental and the spiritual. And I just felt called to do that kind of work.
Mm, wow. And what kind of so do you your clients, what demographic would you say they are, like age-wise and yeah.
So I forgot to say this, but I'm a psychiatrist and I'm in California. Specifically, I work in Silicon Valley.
Mm.
So most of my clients are probably either young adults, probably in their 20s and 30s, and they work in tech, like Apple, Google, all those companies, Facebook. And yeah, those are my clients. And most of my patients have severe depression and anxiety. Those are the most common mental illnesses in the country, especially in Silicon Valley. So I treat them with medications, and I also treat them with something called TMS. And I could talk about TMS for hours, but it's a new procedure where we put magnetic pulses on the frontal cortex of the brain, and that's better than medications for severe depression.
Wow. And I mean, just even hearing what your patients have to say to you and when they're kind of working through this depression, what do you think is kind of this root cause of the depression, especially in these young adults that you would assume who are working in the area that you're serving in, they are, living the high life, having the jobs, doing all those things, working for these amazing companies, but they're dealing with this. What does that indicate to you?
That's a great question. And it's funny you bring that up because this is one of the wealthiest areas in the country. I mean, there's so much money in Silicon Valley. It's the driver of our economy, right? And people, young adults here make at least six. I mean, you can make six figures in Silicon Valley and be considered poor. I mean, that's how it's just insane, right? The prices of houses. But why am I saying that? So people here, you can have all the money you want. You can do, I mean, but it's funny because well, not funny, but it's people here are more depressed than the national average. And people and you could look at the country as a whole. People in the US are more depressed and commit higher rate of suicide than the world on average, even though the US is the wealthiest country in the world. So and why is that? I mean, we could talk for hours about the why, like what's wrong with the society, but I really think the root is loneliness. And we don't have a diagnosis of loneliness per se in the DSM. That's how you diagnose mental illness. But I'll tell you a really quick story. Okay. So I mentioned I was in the Philippines on my missionary work before med school. And obviously a lot of our mission with Consolatio was serving the lonely, right? The poor, but especially the lonely, right? And one Christmas, we had an idea like, oh, we can have like a dinner at our house and invite the people who have no family on Christmas, right? They're just alone, right? And when the funny thing was happened is we couldn't even think of anybody. Yes, it was in the Philippines. It was a very poor, we were in the slums, but there was nobody we could think of that was lonely, right? Yes, they were poor materially, but they had family, right? And shout out to the Philippines, like we're still very Catholic in terms of our families, right? Our culture. Whereas in the US, and again, I love the US, I'm American, but loneliness is everywhere here. I mean, I'm in San Francisco area, like you go downtown, there's a lot of homeless, right? And a lot of them have no family. And I mean, and we can talk about this more, but that's the basic kind of problem. I mean, Mother Teresa said it best. Like she came from Calcutta, one of the poorest areas in the world. And when she visited the US, she said, this is the poorest country I've ever seen. And she wasn't talking about material. She was talking about the spiritual poverty we have. So that's my quick answer
Yeah.
to
No,
why things are here like that.
yeah, and that's actually that's kind of a good segue into just kind of getting into what we're discussing with families. So we'll touch base on the loneliness again in a little bit, but what are some signs of depression or early signs of depression within young adults, within adolescents, children, that parents should be aware of when, I guess seeing the different life stages in their children, um,
Yeah.
what could potentially be some signs of just that?
So let me give you a quick lecture because it's good to understand like this so you understand what's normal and what's not in a child or an adolescent teen. Um, so there's the brain is kind of there's three parts to the brain to simplify it in neuroscience. There's the cortex, there's the limbic system, which is between the cortex, and then the brain stem is in the bottom part of the brain, right? And the brain, in terms of evolution, evolved outwards. So the brain stem is essential to life. It controls your heart rate, your breathing, like things that are your vital signs, right? On top of the brain stem is the limbic system. So the limbic system contains something called the amygdala. It's the part of the brain in the temporal lobe, that's the lobe on the side, that controls our emotions, right? When you're a child, so like I said, the brain evolved outwards, and the last part of the brain to develop is the cortex. The cortex, or the top part of the brain, is what controls our reason, right? It controls, and the cortex suppresses the limbic system and the amygdala. So when you have a child, they're going to get upset. I don't know if you have kids, but I have two kids, two young daughters, and I love them, but yeah, it's just minor things like, oh, you're gonna sit on the left side of the car, the right side of the car. Do you want the orange, popsicle? And then they'll have this huge meltdown, like, oh my gosh, it's the worst. I hate you. So that's normal. I know it sounds weird. I don't know if you saw the new movie Inside Out 2 when she just freaks out at her mom on the bed, but that's normal, right? If you have these huge mood swings to minor stimuli in a teen, it's normal, okay? Because their cortexes are not developed, so their limbic system's in control. Their emotions are just unregulated, right? When you become an adult, the cortex, for most adults, I mean, there's some adults that are still children, but that's a whole other point. But they're able to control their emotions more because their cortex is developed, right? So if someone cuts me off in traffic, I feel upset, but I say, it's not worth it, right? It's not worth it to get upset at them or honk or whatever. So getting to answer your question, what's concerning is persistent symptoms. Okay, so when you have mood swings, it's very temporary, right? You're upset, child, and then the next minute you're fine, right? Persistent mood symptoms is concerning. So if your child is always depressed, so we call this affect in psychiatry, if their facial features are flat, like there's no emotion, they look like you're talking to a machine, they're just kind of like dead looking, if that makes sense, like flat affect, or depressed affect. If they're more irritable and it's constant, if they're losing weight, if they had friends and then they're just all of a sudden stop socializing, that's concerning. If they cut themselves, so a lot of children cut themselves and they don't show their parents, but if that happens, you need to get help right away. Or if they say things that, oh, I'm better off dead, or I don't want to live, and you have all those other things in there, that's where you need to be concerned.
Mhm. And so these are kind of, you mentioned the difference between the limbic system and the cortex. Are there any other ways that can help parents differentiate between, yep, just those mood swings, or the very serious depressive symptoms?
I think just like I said, it's the type of symptoms that are happening and the consistency. Okay. So if they're losing weight, they're not eating, they're not sleeping, those are concerning, right? Because you don't just lose weight overnight. It has to happen over a period of time, okay? If they say things like, I mean, people can joke about, oh, I want to kill myself, but if they say that with a negative or depressed affect, we say, when their emotions on their face are flat, that's concerning. So that's the best. I mean, if you're in doubt, like, I mean, I know it's a lot of things to remember. I have two kids, young kids. I mean, I guess it helps that I'm trained in mental health, but if you're a parent, you don't understand mental health and you're just in doubt, just get help. Just reach out to, it doesn't hurt to get a therapist or to reach out to your GP, right? Because they are also, general practitioners and PCPs are trained to diagnose mental. I mean, they're not as trained as a psychiatrist, but they're trained to treat that. So always just reach out to your doctor. In fact, like PCPs give more mental health or psychiatric medication than psychiatrists.
Oh, wow.
So what that means is that a lot of them treat mental health even before the psychiatrist is called.
Mm, mm. And so yet you mentioned getting help. That's like kind of the more on the like severe end, would you say? What would be some strategies that parents could implement kind of in the earlier stages of maybe recognizing that their child is suffering in that sense? What are some methods or strategies that they can do to help maybe alleviate it? I don't know if that's even.
Yeah. So there's a lot
Mm,
parents can do. I mean, we could talk for hours about this, but I think parents, I don't know if it's, so I'm a millennial and I don't know, a lot of us are parents now, millennials, and Gen Z, maybe not yet, but but I see a lot of parents just on their phones all the time. And I know that's completely separate, but what is that like? You're not really paying attention to your child. Like I've seen so many times where I go out to eat and I see the parents on their phone and their son's right there.
Mm.
And that's kind of inexcusable. I mean, I get it. Yeah, you have to answer something real quick, but you need to be present to your kids and
Mm.
how you need to love your kids. Like one way of showing you love your kids is to be present to them, right? So and talk to your kids, ask them about like what do you like, what's their life interest, how's school, connect with your kids, be present. Um, that's one thing parents can do to love their kid because if you love your child and they know that, they're more willing to talk to you about if they're having issues. So what happens a lot today is parents and kids have a disconnect. And kids, if they are going through mental depression or anxiety, they're not going to want to tell their parents because there's no connection, right? They're going to tell their friends, maybe their teacher, somebody else, or their best friend. So the best thing parents can do is, well, look out for the signs I told you earlier, but also just be a parent, like get off your phone and be present to your children. I guess that's my best advice
Mhm.
to give.
Do you have any either research or studies that kind of help back that up? I mean, that idea of just being present. I know we talked about loneliness a little bit earlier, but do you have any statistics on that kind of involves that depression?
So there's one study, I can't tell you the exact specifics of the study, and it's related, it's not specifically this, but it's related to outcomes and mental health with therapists. And I know you've had a lot of therapists on this show, but they gave a poll out to their people in therapy and they were trying to correlate it with outcomes. So they said the biggest connection with outcomes in therapy was, do you feel like you like or you trust your therapist? Do you feel like they're friendly to you? Basically, are they just a nice person, right? Can you talk to the therapist and you just get along I mean, yeah, they're your therapist, so there's a certain connection there, but just as people, as friends in a way, can you connect with them?
Mm.
And people who connected better with their therapists had better outcomes than people who didn't.
Yeah. So you could correlate that to even connections with your parents if you have a
Yes.
better
I
connection
mean,
with.
if kids generally, I mean, this might sound like common sense, but
Mhm.
kids who have the best outcomes in life, and there's a different ways you can measure outcomes, I guess, but my measurement is, they don't get into drugs, they don't go into prison, they have a job, they have a family themselves. Like that's how I measure outcomes. They're more likely to have that if they have, well, one, it's better if they have two parents. I mean, you could do it with a single parent, but it's harder. But they have two parents that really pay attention to them. They're good parents. They love their parents. They're actually present to the child than the parent that's away all the time. And I mean, we could talk about the negatives, but if you have good parents and you love your parents and they love you back, you're more likely to have better outcomes in your life. That's the bottom line. So,
Mhm. And what are some ways that parents, so let's say it became serious, okay, a child is showing the signs of kind of more of it's not just, mood swings of a typical adolescent, but they're actually showing pretty severe signs of depression and potentially suicide. What are some um how do parents get involved in that treatment process of going to a therapist of, because I think, I mean, you hear all kinds of things out in the world now about therapists, choosing
yeah.
to not allow the parents in the session or to, kind of cut them off from anything that's been shared. Like, what would your recommendation be for how family or how parents can be involved in that process of healing?
So it depends a lot on the severity and the situation. So if your child has a plan to commit suicide and I mean, it's really serious. Like they wrote a goodbye note, they have a plan to do it. You need to call 911 right away, and you need to keep an eye on your child, like if it's imminent. Okay, so that's the first thing. If it's not that imminent, you need to bring it up with your doctor. I think with your PCP or GP, because they can refer you to a specialist, either a therapist, a psychiatrist. Therapists, I mean, again, they're going to figure it out, the PCP, who to refer you to, but therapists generally, I don't know if you want me to explain like what's the difference between therapy and psychiatry. But therapists do talk therapy, right? That's just what they train to do. So they treat more the mild to moderate cases of depression. Okay. Psychiatrists go to med school, so we give medication and we do procedures like the TMS I mentioned. So we see the more severe depression cases. Okay. So generally, if your child is more severe, you see your doctor, and then they're probably going to refer you to a psychiatrist for medication, most likely.
Mhm.
Um, Let me talk a little about meds and therapy. I don't know if that because it's relevant. I'm very conservative with medications, especially in children, because medications have risk and they have side effects. Okay, if someone is severely depressed, like it's worth it to try the med because the risk is high if you don't do anything, right? Whereas therapy is is good for the more mild cases because not everything you need meds for. I think in our society, we're very over reliant on medication. And there's a whole reason why, like big pharma, that's a whole other topic. But if something is mild, I don't think you need medications. Okay. A lot of it is therapy. You can, but I think in our culture, we want quick solutions, right? We want an easy and a quick solution. So it's easy to just pop a pill and then you're fixed, right? Whereas if you go to therapy, it takes work. You have to put effort. You have to learn. It's like going to a class, right? So there's good and bad to that. The good is that long-term therapy is actually better than medication, okay, for the mild to moderate cases. But it takes more time to take effect. So if you're kind of impatient, that's why a lot of people want meds, right? Meds work faster, like short term, but long term, they're not as good as therapy.
Mm.
So that's my quick kind of definition of what treatment does what. And there's no like good or bad. I mean, it really just depends on the severity and the patient.
Right, and being discerning. I like how thank you for clarifying the differences between therapy and psychiatry and going into that because I think that I've gotten confused by that too of, what's the difference between the two. I'm curious your thoughts on so you mentioned, okay, if you see there's an imminent threat, if you see there's, all these different signs, um, I have heard kids, high schoolers even, who their parents don't really know what's going on in their lives and they don't communicate that to their parents either because they don't feel that connection or they're not they don't feel that trust or even just to reveal that. What are some things that parents can do to establish that connection, even if it's like the fear of, oh, is it too late? Like I can't anymore. Or yeah.
Sorry, let me ask the question. What can parents do? Say
What can parents do to kind of establish that connection? So
okay.
if their child's not really communicating with them well, and let's say they're struggling with, some sort of form of depression, what can parents do to kind of help establish a deeper connection with their child so that their child opens up to them? That's a better way of asking.
That's a tough question. I'm a parent too, and I'm trying to figure it out myself.
Yeah. Yeah.
But I think the best thing you could, I feel I've said this already, is you just need to be a good parent. You need to be present to your child. You need to get off your phone and take interest in their life, right? I mean, a lot of people, we are kind of self-centered by nature. It's human nature, but like talk to your child like it's your wife when you were dating her, right? You're interested in the person, you're interested in their life, and it's hard. I guess I have young kids, so it's hard sometimes as an adult to talk to your child. Like I like to talk about philosophy and all these great things, sports. My daughters have no idea what that is. They're not gonna. They'd rather talk about Frozen and I don't know Moana. Like we have different interests, right? But like I really, the funny thing is I started watching all these Disney movies with my child because no, I mean shout. I was gonna say shout out to Disney, but no, not that I would never watch Frozen if I didn't have a daughter. But I love my daughter and she loves that movie, so we watched it many times. And what does that tell my daughter? It shows that I love her life. I love what she likes, and I hope that being a father, that's part of being a father. That if she ever has, I mean, she's still very young. She's only 6, and I have a 4-year-old, but when they get in their teen years, I hope that because my actions show that I love her, she would open up to me if she's ever having a crisis or depression, like if she knows that I love, like my parents really love me and they're not going to judge me for X, Y, or Z, like I should be the first person she comes to,
Mhm.
not her teacher or her best friend. I mean, if she goes there, that's good too. But your parents, parents should be the first, right? Because parents, nobody loves you more than your parent.
Mhm.
That's the so if you like my wife, if I have a problem, I love my wife a lot. Like she would be the first person I speak with, right? If we had problems in our marriage or a disconnect, like I'm gonna go to my friend instead, or so I don't know if that answers your question, but it's
Yeah.
kind
No, it does.
of
And
my
I think
thing.
I mean, we've had a lot of, like you said, we've had a lot of guests on the show that have talked about kind of connections with their children. And that is the thing. It's just starting off small, finding the common interests. And I guess that fear of, oh, if they're too old or not. Nope. I mean, there's always things that you can find a connection to. Um, I would love to hear if you have some positive results from, or just positive stories, or even just the
Yeah.
good that comes out of going to like having a psychiatrist, and just addressing the needs of a child with depression, or even a spouse with depression. Like, what are some positives that come from that?
Yeah, I mean, a lot. I mean, it's a really great work. So if anybody is in med school and thinking about what to do, psychiatry is where it's at. No, it's really I mean, I can think of a lot of examples. I'm just trying to think. Like,
Mhm.
I've had instances where I've talked to people who were lonely and they wanted to kill themselves. And yeah, one time I was on call and someone just called in and said, "I need someone to talk with. I'm near a bridge. I'm gonna jump and kill myself, and I just want to talk to somebody." So he called our office, and it was like 11 p.m. on a Saturday night. I don't know. I just talked to him. I mean, I'm a psychiatrist, so there was a certain, I guess, professionalism involved, but I see myself more as a human first or a Catholic first, or, I'm just a human being and I happen to do psychiatry or I happen to be a doctor. Like that's kind of um, my MO. So when I talk to people that are in severe crisis, I just talk to them, man to man or person to person, like let's just talk. Like, let's just tell me about yourself. Tell me about your life. Tell me about your loves and interests. And it's almost like dating. When you date someone, you don't just say, "Oh, are we gonna get married? Are we gonna have kids?" Like it's not like an AI computer. Like you talk about, hey, what you're getting to know the person, right? The human. And so that's I mean, one story I thought of, I just talked to him and I think I mean, he didn't do it that night. So I guess, it saved a life. I mean, there are other stories. I mean, with the children, children, like I said, I talked about the brain and development. When you change a child's life, it will last the rest of their life, right? Getting psychiatric help early and fixing the problem will extend their life expectancy, right? And they will have good outcomes in life. Like, and good outcomes meaning they're not going to go into drugs, they're not going to go into prison, they're going to have a family and a job. Like that's what a good outcome is in life. And um, so it's good work. And then the last thing I'll say is the TMS. It's really an amazing procedure. It's only been around 15 years, like FDA approved for 15 years. And I could go on about the actual science of it, but I don't know if you want to hear that. But it's almost like a miracle, right? It's for people that are very severely depressed. So they've failed a lot of medication, like medication, just they're resistant, right? And they've been like this for years. So that's when insurance approves TMS. So I do it in my office, and it's almost like, sorry, this is like a biblical reference, but it's like when Lazarus rose from the dead. Like they come in the first treatment and they're just severely depressed, not talking, and then after the treatment, it's multiple treatments. It's not like a one and done. It's 36 treatments of pulse, with multiple pulses, and then they're walking out, they're smiling, and it's almost like they're a completely different person.
Wow.
And I mean, I could go into the whole science of it and why it works, but it's the best treatment I do for in my practice right now. And statistically, it's superior to medication.
Wow. And it's basically, can you explain it to us briefly if you can, if that's possible?
Oh
Like,
yeah,
I know this,
sure.
you
So if
mentioned
you
like it's got
remember.
electro or something with the magnets, but yeah.
So, okay, so let me take a step back. So a lot of people think of ECT. So that's called an electroconvulsive therapy. So that's been around since the 30s and the 20s,
Mm.
okay? There are a lot of movies that show it because it's the second most controversial procedure in medicine. Okay, the most is abortion, right? But the second most is actually ECT. Well, I guess with the gender transition now, maybe that's second, but
Mhm.
sorry, but yeah, so ECT is where they shock you. They put an electric shock on your brain to induce a seizure, right? It's done in the hospital with anesthesia. So it's a bigger procedure, right? It works, so it's still around today, but a big side effect is amnesia. So it wipes out your memories, right? But obviously, if you're really depressed or schizophrenic, you're gonna do it because it's kind of like the last resort, okay? So that is not TMS. So TMS is called transcranial magnetic stimulation. So it's a newer procedure. It's only been around 15 years, FDA approved. So what that is, if you remember Faraday's law from physics, so we have these two circular coils, and it induces an electric charge circularly, and then perpendicular to the charge, it produces a magnetic pulse. So that's Faraday's law, okay? The magnetic pulse is what enters the brain. So it's a targeted treatment to the frontal cortex.
Mm.
That is where depression is caused or anxiety is caused. And the theory is by pulsing multiple magnetic pulses in that part of the brain, we cause something called neurogenesis. So the theory is that it helps the neurons to regenerate, or it helps neurons that aren't functioning to function optimally. And one more thing, this is gonna get approved for soon, is actually in post-stroke patients. So people who've had a stroke and their brain is physically damaged and they lost motor function, TMS has actually been shown to increase brain health and to help people recover. So not only now it's just FDA approved for depression, but there's a lot more treatments it's going to be used for, like OCD, anxiety, stroke. Um, so that's my quick explanation of TMS. It's a newer procedure. I mean, in medicine, anything less than 15 years is new. So it's
Yeah.
a new procedure that has better results than medications.
Mhm. Wow. I mean, that's great to hear too. It's also less, it feels like, I mean, is it less invasive? I mean, obviously you've got things, but it's not medical, like a medicine or anything that might.
Not like so it's less invasive in terms, I mean, the side effects are less too. So
Mm.
when you take a pill, it's a chemical, right? It's made by pharmaceuticals and you ingest it and it goes all over your bloodstream and your body. It's not like targeted, right? That's why you have side effects. You have side effects, you can have sexual side effects, you can have hormone side effects, etc., weight gain. Like it's hitting all these other receptors in your body that are not in your brain. And just some more science, the blood-brain barrier. So that's the barrier between your bloodstream and your brain. It's very hard to go through it, right? Your body doesn't just let everything go into your brain, like it's protected, right? So that's why medications for psychiatry a lot of them tend to have a lot of side effects because they have to be very strong to cross that barrier, to get into the brain, which is where the problems are, right? If you take a heart med, like a beta blocker, or you take like a liver medication, it's easy for the med to get to the site because there's not really much of a barrier, right? Whereas the blood-brain barrier is a more profound barrier. So you need meds that can cross that, okay? So that's, I forget, what was the question?
So the medicines, I mean, so the medicine is more intense because it has to pass that
Yeah.
barrier.
Oh, yeah. So tying TMS is not a chemical, it's a magnetic pulse, right? And if you remember physics, most of your brain is water, okay? Water is a polar substance, right? H2O, it's polar, meaning it reacts to magnetism, right? So the magnetic pulse, when it pulses, it stimulates the neurons in the brain, which are mostly made of water. That's how it works on a physics level.
Mhm.
And the good thing with TMS, it's a very targeted treatment, right? You're not touching all the rest of your body. It's actually used in pregnant women, right? In the ways it's more safe in pregnant women than a medication would be, because that medication can cross the placenta barrier with the baby, right? Whereas TMS, it's purely just treating the frontal cortex and nothing else, right? So most people I do TMS on have no side effects.
Mm.
Most likely, if they have a side effect, it's just headache, and it usually just gets better, like in 5 minutes. So it's a better treatment, in terms of efficacy and, side effects.
Yeah, that's great. That's cool and very exciting, especially since it's only 15 years old. I mean, it's new and it's interesting.
2008. I graduated college 2008, and that's when it was FDA
Oh,
approved.
wow, okay. That's awesome. Just kind of to round out the conversation, do you have any words of hope or words of support for parents who might be struggling with helping their child or helping their child who struggles with depression and just kind of there's a light, any word.
Yes.
Yeah.
So I'm going to bring up religion a little bit, if that's okay. Because, well, I could have a whole conversation about why, but
Mhm.
there's a Catholic physician, Adrienne von Speer. She's also a theologian. I think she lived in the 30s, I forget. But as as Catholics, we're it's different for us, right? If you're completely secular, and most of my patients are, secular atheists, and that's totally fine. And we kind of focus more on the symptoms. I do my job well. But when you're Catholic, there's something extra, right? There's more meaning to suffering and pain, right? And Adrienne von Speer said, she was a physician, so she saw a lot of suffering and pain in her life. But she said those patients were kind of like helping them in their mission, right? I don't know if you ever heard growing up, like just offer it up. Like, yes, you have suffering and pain, just offer it up, right? Your studies, your work, it's all for something greater, right? Even though it's not pleasant to do, like I'd rather play video games, right? But I work, I study, or because it's for others. Like if I study harder, it helps me help other people more, right? So tying it back to the patients is you know, sickness and illness. I mean, we could talk about philosophy and theology and Buddhism, like why is there suffering? Why is there illness? I mean, you can give a whole course about that, but it's just a reality of human life. Every person will suffer at some point. And I guess as Catholics, there's meaning to that, right? Like we believe that this life is not, sorry if I'm getting too theological, but everything we suffer in this life has some meaning, right? My mental illness, when I was depressed, I mean, I hope at the end of the day it helped my family or it helps my kids. Like I offer it for them, right? So don't think that suffering is bad. I mean, yeah, it's unpleasant. Quick story. So my brother, he's in the military, he's special forces, he's a ranger in the army, right? And when you become strong or spiritually disciplined, I think of Saint Ignatius, who's a soldier. He founded the Jesuits, but you don't you kind of have to suffer, right? You don't become a soldier or special forces by just kind of playing video games all day and having all this pleasure, right? They make you strong. They put you through the courses and they I don't know if you like the training they do. It's hard, right? Um, so why am I saying all this? It's sometimes yes, people suffer, we have pain, we have mental illness, but we can use that to make ourselves stronger, right? That's kind of the light, right? Like it's not that suffering is bad, and I do my best to treat it, but that's what I tell my more Catholic or religious patients is like, use this, right? This is something you have, and I'll do my best to help you, but like pray and use this for some greater good, right? Um, and then I guess on a completely secular level is we need I think this is most of my patients are not religious and atheists, which is great. But I think we just need friendship, right? We need presence and friendship and virtue, right? That's the positives, right? Like we could talk negative all day about suicide and statistics, but at the end of the day, like it's if I think the most important thing in mental health, one of them is just having that connection with your physician, having friendships, feeling loved, feeling wanted. I mean, those aren't diagnosed conditions. You don't diagnose that, but that's what the human heart needs is kind of feeling wanted and feeling loved.
Mhm.
So that's what's part. And I meet a lot of people. I see, I think like 17 patients a day. So I'm a very busy schedule, and it's easy to look at the negatives. It's easy to look at, oh, this guy was a child molester, or this guy did this. Like I see some interesting patients, right, that don't have the best lives, I guess, from not to be judgmental, but like they've had difficult lives. And but they're still good, right? When I visited the prisons, I talked about my mission and people who had committed murder, there's still something good in them, right? There's a beauty to them, to their life, right? Not and it's easy. Sorry if I'm talking a lot, but it's easy to judge people, right? It's easy to label someone, and that's kind of the whole stigma of mental illness. It's like, oh, you're schizophrenic, you're depressed, and you kind of label somebody. It's like a reductionism by labeling. I think somebody else mentioned that in your podcast earlier. But that's kind of how we label people, right? But no, like we're a human person. Like we're not a schizophrenic, we're not bipolar. We're a human being that happens to have depression, and we happen to have X, Y, or Z. Um, so why am I saying this? The positive is no matter what you have, no matter if you're schizophrenic, you're in prison, or you're whatever, there's good. There's some good in each person, right? Um, and you can edit this out, but I'll say this, if you look at Jesus's life, he loved Judas. And I know we can label Judas, we can judge him like, oh, he committed suicide, he's in hell or whatever, and Jesus knew this, right? He knew he would be betrayed, right? And I mean, can you imagine your best friend or one of your best friends betraying you to be killed? Like, I don't even know. Or imagine someone killing your child. I mean, you can't even imagine like what you would do, right? And this is a whole mystery. I mean, we could go give a course about this, but he knew this, and he betrayed him, and he still loved him. He still like washed his feet. He still had the Last Supper with him, and that's something you can't really teach that, right? It's so I guess what my point is, like even Judas, like there's a beauty to him. There was something good in him that he saw, and he loved him. Just like if my daughter, I mean, God forbid, if whatever they do in their life, I mean, maybe they don't do everything I like, I'm still gonna love them as much as I can. And that's the positive I see in all this is we're human beings, and in our heart, I think Pope Francis said this, every human there's a lot of good in our heart. Even though people can do bad things or make bad choices, but the human heart is still good. So that's the positive. Maybe I talk a little too much, but
No, no, it's great. I have one last question for you before I let you kind of share with us your practice. This question won't be on the podcast, but it'll be a part of a montage. But it's how has Mary been a mother to you in your life? The Blessed Mother, how has she been a mother to you?
great question. I've always been devoted to Our Lady since I was a child. I mean, my mom, so I'm Filipino, so that's, I guess, Our Lady of Guadalupe is special to me. I visited her when I went to Mexico, and the same trip I went to the hospital that I talked about, and I can't really put in the words. It's like it's the mother, it's the perfect mother you can have that's always watching out for you. And I talked a lot about my life from a purely, I guess, uh, maybe like how do I describe it? It's always like she's had my back. I've failed so many times, I've sinned so many times, and you know, uh, but it's when I look back on my life so far, it's almost like everything was meant to be, right? My mother was watching me, and I feel called to do what I'm doing now with my patients, and it's almost like my whole life purpose led me to this point. It's almost like it was predetermined in a way, but it's hard to describe. It's almost like when you have a child. I don't know if you're a mother, but your child's going to fall. They're gonna, when they're a toddler, they're going to put their finger in the outlets. But the mom and I guess the dad too, they're like watching their child like a hawk, making sure they don't screw up, right? It's kind of like that with me. It's like it's somebody that loves you, and I know we could talk about the hypothetical, like how do I say it? It's tempting to think, oh, Mary, Jesus, they're kind of these distant figures in heaven that aren't present, but for me it's like they're present, right? Every moment of my consciousness, they're on my mind. And even before this encounter, I prayed to Mary. I said, Mary, I hope that I don't screw up, or I hope that my insights help people like that. It's almost like it's like your wife and your father and your mother and your kids all combined to one, and that's how present she is in my life. I know that sounds weird, but
No, that's
it's
beautiful.
everything. And I would die for her, really. I would die, and it's I mean, God already died for us, so it's already I don't know if that answers your question, but it's you
No.
can't really put it in words.
Yeah. Yeah, that's beautiful. Thank you. Okay, just to round us out, can you share with us your work right now? If you are, where you're at and kind of if your psychiatry business is open for clients or
Oh, yeah. So I'm in California. I'm in the Bay Area, Silicon Valley. But the good thing is I'm licensed in California. So if you're anywhere in California, I'm available if you want to see me. I'm Catholic, so I get a lot of referrals from the diocese because but even if you're not, like I practice the psychiatry as well as I can. So you don't have to be Catholic to see me. Most of my patients aren't. I work for a company called Mindpath Health. So it's an outpatient psychiatry outpatient psychiatry practice. And yeah, it's the largest outpatient practice in California. So shout out to MindPath. Yeah, if you just Google me, Julian Lagoy, MD, MindPath Health, my page will come up and you can schedule an appointment.
awesome. Well, thank you so much, Dr. Lagoy, for being on our show and sharing with us your expertise. And I'm sure our listeners will definitely have taken something from this episode.
Thank you, Mary Grace. Thanks for having me. And yeah, it's been an honor. Thank you.